This is Healthify 247, and we are a channel that is focused on bridging or bringing to bear health concept as well as health related contexts. And we are your host, Eddie, and we have
Victor here.
yeah. So today our guest is Dr. Robin Adams, and I would say that as she is identified as they or them, Dr. Robin Adams is an assistant professor of communication at Texas Tech University. And so today we are looking at the place of culture in health. So I want to ask Dr. Adams, I want to know from you, how would you define culture and how does it impact lifestyle and health?
Right. Well, I'm going to give you my definition of culture, and I would
Okay.
say culture is really just it's hard to I would say it's eternal. It's everything that makes up who you are, and especially for Black folks across the diaspora, it's the way that we talk, the way that we walk, the way that we decide to clean ourselves, the way that we decide to maintain our homes, how we choose to eat. And so culture is influential in health because health is a part of our everyday experiences, and health is such a subjective word, because healthiness means different for everybody. For my parents, healthy means that they're able to get up and go to work and provide for their family. For somebody else, health may look like, do I have the ability to attend all my routine visits with my medical provider, with my dentist? And so that's kind of the ways in which health is blended with culture, is because depending on your culture is depending on how you look at health and what healthiness means for you.
Okay.
All right, so Dr. Adams, I don't know, but then how do cultural beliefs and practices influence an individual's approach to healthcare and wellness?
Right. And so, it influences in many ways, right? So kind of like what I said before, depending on your culture is depending on the type of health decisions that you'll make for yourself. But I think more importantly, I like to talk about the ways in which the healthcare system, especially within a U.S. context or a Western context, has not been always accepting of other people's culture, which influences the care that they receive. And so looking at one of my many examples that I use in the beginning of someone where for my parents, health looked like, are they able to get up and provide for their families? Are they able to do everything around the house as well as outside the house that kind of brings in resources for the family? There have been times where my dad has visited the doctor, and because he is an entrepreneur who does not work for someone else, so he doesn't have standard health care, has not always been welcome within the healthcare system, having questions about why haven't you received your routine care? You're not healthy. But for him, healthiness means so much more than what a doctor can see when they evaluate him. And so health kind of, when thinking about it, cultural practices, I think, it's a very sensitive conversation because health practices can look like some for people, like especially in my household, where our health practices are more rooted in spirituality and culture. And so when someone gets sick, we don't necessarily run to the store and get cough medicine, but it might be looking like drinking herbal tea or sitting in a hot bath or wrapping yourself up tightly in blankets and allowing yourself to kind of sweat the illness out. And so that's kind of some of the ways in which culture can really influence healthcare practices. It's the relationship of how people choose to define health, what wellness looks like for them, and then them also utilizing practices that sometimes are passed on through family traditions. It may include some perspectives from the healthcare community, such as, medical doctors, but it can also look like something that's outside of that space.
All right, so then it leads me to a follow-up question. So can you share examples or like where cultural competence in healthcare has made a significant difference in patient outcomes?
Right. So, I think that cultural competence within the healthcare system, it's interesting because I think that there is not that much of it, to
Mm,
be honest.
true.
Especially within the US, cultural competence is really limited to what is understood by a westernized perspective of medicine. And
Mm,
so that usually is coming from what I really like. This book is called Critical and Cultural Health Communication. And they talk
okay.
about how a lot of the ways in which healthcare system functions in the US is based
Mm,
off of
mm,
perspectival thinking.
mm,
And so this idea that you go into the healthcare system, the doctor's understanding is based off the books that they've read, the education that they've received. And
mm,
then there becomes like this power dynamic where a lot of the culture and understanding about health is kind of built around what was understood in another institution, such as the
mm,
education system.
mm,
And, in some ways, it does work for people who kind of fit these dominant ways of being. So, those who are white, thin, wealthy men who have, they're doing financially well. But
mm,
anybody who kind of fits outside of that context, um, sometimes there's not really positive outcomes
mm,
because there isn't this shared understanding of the ways in which maybe sometimes the knowledge that is gained within the education system, like medical schools around health, is really limited towards taking care of white men and white men who are able bodied and who have money. So for those who are kind of operating out of that context, they tend to encounter negative health outcomes. And so
mm,
one of the areas that I'm really invested in is looking at Black maternal mortality in the US. And
mm,
so, Black women across the diaspora have sometimes upwards of a 5 times more
mhm,
likely to die
mm,
during childbirth or
mm,
along their pregnancy experience compared to white women. And then this disparity is sometimes even higher. It looks different depending on if you are disabled, you
mm,
are queer, you are poor.
mm,
And so that's just the ways in which when there isn't a cultural competence there, of understanding how someone who may be dealing with being poor, cash poor, not having the resources, or who may not have health insurance, how there is a lack of cultural competence of understanding these communities, understanding the ways in which they may be subverting the healthcare system, like taking herbal remedies or doing
mm,
things that are outside of the healthcare system.
mm,
And because of that lack of cultural competence, there are really dire consequences, such as
mm.
people losing their lives.
True, true, true. Okay, so Alice, we as Africans, as in me and Victor, Alice, we know that our cultural background or what you know about our culture shapes our thinking. It shapes our understanding of health. But we want to find out from you also, in what ways do you think that you personally, how has your cultural background shaped your understanding of health and healthcare in general?
Right. I mean, I've learned a lot of it just by looking at the elders within my family.
Mm,
And then even just really thinking about my parents, my mom, I was the last child that she gave birth to. And then
mm,
after that, she had her tubes tied. But because of the lack of care that she received, she ended up having an ectopic pregnancy shortly after me where she almost died.
oh.
And she was talking to her doctor saying, "Hey, I'm in pain. I don't think that something is right." And they really kind of minimized her experience and made her feel like, "Oh, your tube's tied. There's no way that you can be pregnant." And if it wasn't for that time, my dad really encouraging her to go to the emergency room, she was days away
Mm,
from suffering a lot of internal bleeding. And when I think about my experiences, just as a African American, Black American within the
mm,
US context, and just how close I am to slavery,
mm.
slavery is not that far away, as people like
Sure,
to see. When
sure.
we look at research, there are documented slaves within the South, specifically within the Texas, Georgia, and Mississippi area, who were
Mm,
slave all the way
mm,
into the 1960s.
true.
And so when we think about that in the context of the ways in which we have been oppressed as a community. That's not just limited to our everyday experiences. That is going into the healthcare system. That is also with government and policies, right? And so, we're hearing things right now like talking about Black jobs. What is a Black job?
True. What is
In 2020, the CDC came out. Rochelle, the director of CDC at the time, and said that racism was a public health crisis. And so, and they were specifically talking about that within the context of the Black community, and the ways that Black people were being treated and have continued to be treated within the healthcare system. And so when I think about kind of what I'm seeing from the news, what I see from my personal experiences, what I've seen documented throughout history, and the ways in which, Black people have been violated within the healthcare system in the world at large, it really has just had a big influence on where sometimes I may feel safe at coming to about my healthcare needs. There's a lot of times that I go to families and friends, or I go to local community organizations when I have questions about my health, or I'm trying to provide health related resources to other people, because I know of the history within the healthcare system of be excluding people who look like me, and then if we are included, not treating us well, being harmful in a lot of situations.
Okay.
That's impressive. So, can you walk me through the challenges that healthcare providers face in delivering culturally sensitive care, and how can these be addressed?
Right. Well, I think one of the things that we're kind of starting to see, just even on an academic level within the state of Texas, is a lot of these anti-DEI policies. And the reason why they're really harmful is because before someone becomes a doctor, they have to go to school. And so when we see a lot of these anti-DEI policies happening within the context of academia, it's really preventing a lot of our future doctors and medical providers, our nurses, our nurse practitioners, our physician assistants, everyone who works in the medical care system from having cultural related training, whether that be, and also the encouragement of having training. And so now you're kind of putting people in a position that they're not going to have this type of training a part of their regular curriculum. And so now they're going to have to be forced to look outside of the academic setting. But then you have to ask yourself, what is the incentive at this point? If the people who are running these programs, who are developing the laws and policies, are saying that this is not necessary, and in fact, this is harmful, even though that we know it's not. And so I think one of the challenges that medical providers face is that we already know that the healthcare system is overwhelmed. We saw that within COVID-19, just how much pressure medical providers had within the system, how people are, really do not have time to talk to their patients in a way to get to know them. And so when you have a structure that is operating off of kind of racism, this fear of kind of really implementing education that allows them to understand about other cultures, and then you also have a system that's overwhelmed with patients, and there's not enough doctors, and people are not being paid in the ways that they should be, then it just creates, an overall system that makes it really hard for medical providers to develop a relationship with their patients that allows it to be a relationship that is, equal in power, and for that person to be able to walk away and make healthy decisions for themselves.
Oh, okay. So at least talking about cultural competence, and at least how healthcare providers should be in a way sensitive of, or at least they should be aware of. But I don't know, this brings me up to another question, which I think that probably it's links to that also. But I just want to find out from you, what aspect of culture, in your view, do you think that healthcare providers should be, or they should look at more, or they should be aware of?
Right. I think, it's really hard because, you can't learn everything in a day. And you can't learn about everyone's culture, but you can take it on an individual basis. And so
Okay.
while the training may not be available in a standardized course that they can now take in medical school or receive during their residency, and I also don't want to speak just exclusive to doctors, but even nurses too, is that when they meet someone or they have a patient to come in really participating in active listening instead of assuming. And so having an understanding of people's personal experiences. And so an example of that is, I conducted interviews with a group of Black birthing people about their pregnancy experiences. And one
Okay.
of them spoke about how they lived through a miscarriage and they had their miscarriage at a military base with a doctor. And the doctor didn't even know that the day prior that the patient was in a domestic violence situation
Mm.
where their
Oh.
partner had physically assaulted them. Had the doctor really looked into, hey, what's going on? Has there been any changes to your living situations? What's going on in your personal life? There could be so much understood about the context of what was happening with that birthing person outside of just, once again, what the doctor could physically see. And I know it's hard because, like I said, the healthcare system is overwhelmed. The doctors really don't have a lot of one-on-one time, or nurses do. But if there could be this collective understanding within a healthcare system that people's lived experience matters, their everyday experiences matter, we have the models that support that. When we talk about the social determinants of health, we know
Sure.
that where people pray, eat, live, where they work, all of that influences their health. And so if we can have those conversations, a part of the visits, a part of when people are looking for healthcare related resources, then that will give us insight on people's culture.
Mm, true, true. But I think that I'd want to also more or less ask a follow-up from at least what you said about obviously dealing with it individually or having it being looked at in a single manner. But you mentioned of diagnosis and you looking at or you bringing forth some things that healthcare providers do without not going in depth or without not trying to find out more. I think that brings the concept of the medical gaze also. Yes. And I just want to find out from you, do you think that the medical gaze is appropriate or it is absolute in its function generally?
I think for the most part, it doesn't work as a sole uptaking for doctors. And so
Okay.
I will say, when Foucault came up with the concept of the medical gaze, it does have somewhat of a negative connotation because it's relying on the fact that the doctor's knowledge is more important than the person who's actually experiencing the health related problem.
Sure.
Or, that more about someone who is living with their body every single day. I know
Mm,
more about my body than the doctor does. The doctor
sure.
knows about general medical information and has the expertise to kind of point me in the right direction, but only
Mm,
if they understand my story. So I
mm.
say that to say that the medical gaze is not an effective strategy um,
Oh.
by itself,
Mm,
because it excludes the person's feelings, their emotions, their understanding of their health, and it solely relies on what the doctor can see and what the doctor can evaluate.
mm. Okay. Okay. Thank you for that.
Okay, Robin. So I know a community health worker is like a frontline public health worker who's a trusted member of the community like they serve. So I want to know, what role do community health workers play in bridging the gap between healthcare systems and culturally diverse populations?
Yes. And so, I'll give you one example that, community health workers, it's the healthcare system itself that is non-traditional.
Yeah.
Community health workers are tradition. They are entrenched in tradition,
Mm,
especially within the Black community. And so even when we think about C-sections, cesarean sections with pregnancies, that was a practice that was initially established in Uganda. And missionaries from within a westernized context traveled to Uganda. They stole the practices and then came back, right? And so when we think about community workers, we're not talking about people who just go to school and they get the community health worker certificate. We're
mm,
talking about people who live in a community and who have been generationally responsible for
mm,
taking care of folks. And it is so important because a lot of times they get to have so much knowledge that the healthcare system hasn't been able to establish in a relationship with the community because the healthcare system does not live in the community. And so another example that I would give is that, I work within maternal mortality and the benefits of having a community-based doula. And community-based doulas, people who practice doula, even people who are midwives, community-based midwives, they have been essential to saving lives. And so it's really just outside of a US context. When you look at the UK, most births are facilitated with the assistance of a midwife or a doula. And
Sure.
and in some ways, these could be looked at as community-based systems, community workers that are really there to help kind of bridge, to fill in a gap where the medical system cannot provide that emotional and mental support. And so one of the things that we talked about earlier in this conversation is the ways in which we do recognize that the healthcare system is overwhelmed and these doctors are not necessarily receiving this cultural competence training. We
Sure.
know that these policies or what is needed to establish that is not going to happen overnight. But what we do have is these community workers who already have that type of training, who already work in the community, who can come in as an aid or assistance within these healthcare environments. And so more recently, I just completed my doula training this summer. And a part of my job as a doula is to fill in that gap, right? So before the birthing person reaches the hospital, making sure that they have a birthing plan, they have an idea of what they want their pregnancy to look like, because we know that these doctor visits are going to be really fast paced. And so if we can have some of these conversations ahead of time, I can go in with them. I can remind them to ask questions that maybe that they have forgotten to ask. And also have them think more broadly about what their experience is going to be outside of the physicality. So how do they feel emotionally? What is information that they're looking to gain and helping support them in the system. But even outside of that, community workers are outside of just doulas and midwives. They are also just your neighbors. Your neighbor that checks on you and they ensure that you have enough food in your house, right? And so I like to look at it in a sense that when it comes to, health related issues, we all can be community workers. That means you just being a good friend, you being a good neighbor, you being a good family member. And I think that, the healthcare system is going to have to learn to value these systems of support that people establish and figure out how do we kind of bring that in conversation within non-traditional healthcare systems like the hospitals and things like that.
Oh, okay. Okay. I think talking about community health members or even community health care providers, that also brings in the question about divisions within, even with regards to what is being accepted within a particular community. So we as Africans, or we as Ghanaians, we have a both, or we deal both in the orthodox medicine as well as the traditional medicine. And I think that as a Black feminist also, I'm sure that you might have at least dealt in these forms, or these two forms of medicinal approach. But I want to find out from you also, looking at these approaches, they are different in their own light. They are of their own independence with their approach. How can we blend it in? How can it be blended in fostering or in bringing out better health outcomes?
Right. Well, we have to, I think when we're looking at the healthcare system, the healthcare system has to be more open to bringing people outside of the healthcare system to
Okay.
be able to teach them things and there to be a relationship. So in fact, next week, I actually am going to a hospital, which is called Parkland Hospital in Dallas,
Okay.
um, and talking to the medical providers about the importance of them working with community workers. And I think there has to be a bridging there. So one of the things that, for example, with my training as a doula, not only are we keeping informed with some of the medicalized language and knowledge that's happening,
Yeah.
but those who trained me also did training in Nigeria, right?
Okay.
Because we recognize that there are gaps even in our understanding of birthing that have been colonized. by a white perspective. And so if we really want to understand the birthing experience, we have to go to the continent where birth first happened, first
True.
originated from.
True.
And so I think a lot of community health workers are open to that, but I think it's about us continuing to have conversations within for medical providers to understand that this is not trying to take away your job as a doctor or nurse, but this is trying to ease your job. This
True.
is trying to understand, like, hey, we know you're overwhelmed. We know that you only have so much knowledge, and it's not to discredit your knowledge, but we want to add more information to you that can complement what you already know. And so I think that looks like going into healthcare environments like the hospitals and talking to the doctors, talking to the nurses. So one of the things that we talk about even as doulas is the importance of building a relationship with the nurses on staff and saying like, hey, you know, I'm here to help. I'm not here to interfere in your job, but you know, you might not need to come to this room every 30 minutes. Because I'll make sure that I'm keeping up with the chart and I can pass that information along. So really allowing the healthcare system to say, you know, we understand the gaps that you're facing, and this is ultimately to give you complementary information to save lives, not to say that your job is not valuable.
Okay.
Okay, Robin. So what are some of the specific health disparities faced by individuals from the LGBTQ plus communities, and how can cultural competence help address these issues? Are there any specific disparities?
Yeah, so what I like to talk about, I mean, I largely focus on Black LGBTQ populations. And so I think some facts that I always like to do to get people grounded in is that one, 40% of Black queer people live below the poverty line. So that already sets the stage, right? Because we know that most people get health insurance through employment, right? And so if 40% of Black queer people are living below the poverty line, make $21,000 or less annually, the chances that they are receiving health care insurance from their job is least likely. Black women who identify as lesbian or bisexual are 4 times more likely to lose their children to the state compared to Black straight women. So meaning that they are usually surveillance by places like CPS who are like, oh, you can't take care of your kids. We need to take your child out of the environment, instead of looking at the ways in which the structures are racist and have put them in an environment where they cannot feed their children. Additional to that is Black queer people, when navigating the healthcare system, are more likely to be discriminated against. While there are policies within the healthcare system that are supposed to prevent doctors from being explicitly racist or discriminating against one based on race, there is no policies that are mandated across sexuality or gender orientation. And so once again, there isn't that initiative to want to understand Black LGBTQ folks within the healthcare system, which leads to a really big gap of being able to provide care. And so cultural competence, by just even having policies that say, hey, you cannot, mandating hospitals, you cannot discriminate somebody based off of their sexual orientation or their gender identity. That could be the first step. The next step would be being able to understand the structural issues that Black LGBTQ people face, particularly like poverty, because of the poverty rates, Black LGBTQ people are more likely to be unhoused, as well as not have access to quality food. And so if you just understood that basis right now, that disadvantage, that someone is coming in as a Black LGBTQ person into the healthcare system, that can start you off on a different point, right? Because you might not say, hey, you need to increase your walking if they don't have a home. You know, they don't have anywhere where they can walk, right? Or you can't tell someone, hey, you need to improve your diet if they're not getting access already to basic necessities such as food. And so understanding some of the issues that Black LGBTQ people are facing will be able to assist medical providers in figuring out what type of care. And maybe we don't need to focus on getting you a test right now. More so, we need to focus on making sure you have food, you have housing, you have transportation before we start to deal with these other issues.
Okay, so talking about health disparities and at least things that we think that at least in terms of race or in terms of gender or in terms of sexuality, that is one aspect. How
Mhm.
about in terms of origin? So how about how can we solve health disparities looking at, okay, how can we incorporate probably people from foreign nationals, or people from foreign origins? How can we also bridge that gap in making sure that at least everyone is being looked at universally?
Right. So I love that you're bringing that up. And one of the things that we talk about for those of us who are Black feminists that come from a transnational perspective is that if Black people are not free across the diaspora, Black people will never be free within the US context.
Mm,
And that's really important, is this issue of colonialism. A lot of the practices that we see of racism that are happening here in the US context happened way before,
true,
on
true.
the continent of Africa. And even when we're looking at a lot of the medical advances that have happened, even around like some of the studies that were produced off of the backs of
Mm,
Jewish people during the Holocaust. The
mm,
original template of the Holocaust was established by the Germans was through colonialization within
true,
Africa. And then
true.
they took that framework and then they implemented that framework within a context here. And
Mm,
so, I think one of that bridging is that we have to get the perspective of, and I speak solely from the Black perspective of what Black people across the diaspora are dealing with in Haiti, Black people across the diaspora are dealing with in Kenya and Nigeria, and looking at the ways in which colonialism, especially within the healthcare system, has stretched its arms, and
mm,
we are just merely mimicking that framework within the US context. So that
mm,
means reaching out to other scholars, that means traveling, hearing stories, or in the case of those of us who are doulas, who are birth workers, getting training outside of a US context,
mm,
getting
true.
training from people who have different cultural perspectives that are not limited to a westernized understanding of medicine, and
Mm,
inviting them in and using resources to bridge that gap.
That's true. That's true.
Okay, so yeah, I have one final question. I want to know, how does the intersection of culture and like mental health play out, particularly in addressing stigmas around mental health in different communities?
Mm,
Mm. Well, it's so interesting because even when we think about mental health, a lot of it has been understood here by, once again, a westernized context. Even how we look at issues of depression and anxiety, which are very real things that people are dealing with. But what we feel like is um kind of the best way to approach that is different, right? And
mm,
so I think it's about keeping a balance, giving people resources. For some, that may look like, being on medication, but that shouldn't always be the go-to for everyone. Some
mm,
people are just looking for systems of support. And so one of the things that we do, I work as a research consultant and a community activist and member at a reproductive justice center here in Dallas called the Afia Center, is that we do storytelling circles. And so
okay.
we bring people together, Black birthing people together, or Black people who are living with HIV. And
Mm,
we bring them together to be in community with each other and sharing their stories. And one of the things that they always talk about is the healing nature of
mm,
being able to talk about your experiences in a safe space, and how much of that influences their mental health in a positive outlet. And so I say that to say that when we think about, mental health and in relationship to intersectionality, every community is going to need something different. And so for somebody like a Black woman or a Black queer person, that may mean they meet other people around them who have had the
mm.
same experiences as them, as that they can learn from. And they're most likely not going to get that within the healthcare system.
Sure. Sure, sure. Well, I think that at least before you go, I just want to ask at least one final question. Talking about health and culture, health disparities, health equity, health inequalities. I don't know. Do you think that maybe if you can offer some areas or some research interests or ideas that you think the academic community can look at. Alice.
Right. I love statistics, I love data, but I think sometimes the issue can be with that is that we only see problems where there is data to understand it. So in the case of Black queer folks and their birthing experiences and maternal mortality, people haven't come to them to ask them about what they're going through. And so if you were to look at the data, there's not much out there. And so I think that, as researchers, it's our responsibility to also understand the world around us. And understanding the world around you is not just reading articles. It's not just reading books. It's not just taking classes. It's going out into your community and listening to people's experiences. And there's nothing wrong with exploring topics that are personal to you, that are related to your family, that are related to your friends, because you then have the power to create a safe space for these people to tell their experiences because you know them, because their relationship. And it's okay then for innovations to be born out of that, off of listening to people's experiences. And so I wouldn't say necessarily there's a topic, but I would encourage, those who are interested in understanding the world around them, who may be researchers, to start with their community, to start with understanding the power of just documenting storytelling, and having that storytelling be able to be a part of the archival history of their culture and their community. And then, allowing the building to come from that, but to stop allowing the institution to tell you what's important to study. Figure out what's important to you and then go that direction.
No, okay. Thank you for that, and thank you for your, at least for this insightful conversation. We are really happy to have you on this first episode of this our health series. We are very
Thank you for sharing
your insight,
your
everything.
expertise with us.
Yes, I'm so happy that you all had me. I can't wait to tune in to the other episodes, and it was a pleasure talking to you all.
Okay. Thank you also.
The rest of your
Thank you.
weekend.
All right. Bye.
Bye.